Yeah,
Sige.
thank you very much. Actually, I did my residency in the United States. I left
Okay.
the Philippines in 1987
Mm-hmm.
and did my training in New Jersey for internal medicine. And as Doji said, luckily I fell into a position for infectious disease as a fellowship uh, uh, for 2 years. And at this time, this was the height of the HIV pandemic, and I was offered a position or direct medical director as the early intervention program director at St. Mary's Hospital, which I still am for the last 28 years now. Um, Aside from that, I do HIV. I used to do HIV clinical trials for medications, phase 3 trials, and I'm now a director, medical director at North Jersey Community Research Initiative. I do have my private practice, and that's what Doji was talking about, and that's where I
Yeah.
do most of my infectious disease. Um, I think Abby, you have my slides, right? If you can
Okay po,
please,
I can share it for you. Yes,
yes,
I'll
thank
share
you.
it for you. Okay. Share.
There.
Is
Okay.
it okay po?
Yeah, can you make it full screen or that's about it. That's
Ah,
fine.
yes po. Ah, okay, wait po. Sige.
Into
Wait po.
presentation view, I think,
Yes,
right?
here po, use slideshow view. Is it okay po?
There we go.
All right.
Okay, so when we were trying to come up with the topic for this talk with Oliver Berong, he wanted to know more about what I do and what organisms were in general. So we came up with a topic of trying to say demystifying the unseen world of microorganisms. We do live in a world where everything is covered with microorganisms. And the fortunate thing is that most of these organisms or bugs are not dangerous, actually are helpful to our way of living, and they contribute to life in general as the big circle of life continues. Um, Next slide. Um, so basically, we were just discussing how vast the world is, how many microorganisms there are. Are they all scary? They're not. There are certain organisms which we call pathologic that I will try to touch on as much as possible from the different kinds of microorganisms and how do we coexist with them. It's just basically our body is covered with trillions or hundreds of trillions of organisms, and basically a microorganism is a single organism that either forms colonies of cells and were first seen in 1670s. However, doing my research, I think the microscope was discovered in the 1750s. So they probably have seen the larger single-celled organisms, and the ones that we know that can be harmful or pathologic have been seen through the microscope since then. Next slide. So basically, what I'm going to try to touch on are certain bacteria, which are obviously the ones that we know most commonly about. Protozoa are single-celled organisms that I will also touch on. Fungi, um, not the mushroom kind, but mostly the ones that cause infection. And obviously, viruses, uh, which were later discovered with the advent of the electron microscope. Next slide, please. As I mentioned earlier, we're covered with over more than 100 trillion microorganisms in our body, mostly bacteria. Next slide. To give everything, put everything in perspective, these are just some of the few pandemics that the world has had over the years. Um, the Antonine plague, which was from 100 around the 150 A.D. Um, the plague of Justinian, which was in the 500s A.D. HIV, which we obviously all lived through, are still living through it at this present time. Um, the Spanish flu of 1918, which most of our grandparents have lived through, and the Black Death, which was in the 1300s. If you'll notice that this, the Black Death, more than 60, 80 million people have died, and it almost wiped out the whole of Europe at that particular time. There are other pandemics in history, uh, and obviously the one that we're in right now, the COVID pandemic, we will touch a little bit of later on. Next slide. So common bacterial infections. One of the most common illnesses or infections I deal with on a daily basis are sexually transmitted diseases, from Neisseria, gonorrhea, chlamydia, and syphilis. Basically, Neisseria, as you know, are sexually transmitted, purulent uh, um, diplococci. They're round bacteria that, as you know, has had one of its most common symptoms as painful urination. However, it can also get into your bloodstream and cause serious bacterial or blood infections. Chlamydia trachomatis also is another non-specific urethritis infection. Men usually manifest the symptoms, women don't, as a general whole. And for syphilis, this is, we're having a resurgence of this infections in over the last year, and actually during the pandemic, we've seen more and more cases of these sexually transmitted diseases. For syphilis, there are three phases or stages: stage 1, stage 2, and stage 3. Where in the stage 1, you get a ulcer, which is painless near your genital area. And if you don't mind this, and most of the time you don't notice it because it's obviously painless, it just goes away on its own. Secondary syphilis is when it spreads systemically in your body, where you can get a rash and can go into different organs in the body. And after that, the rashes do fade away if this is left untreated, and it goes into what we call the latent stage, and can be for 20 to 30 years before it manifests the tertiary stage as either a cardiac illness with aneurysm formation in the aorta, neurologic, which can affect the brain, or as a localized manifestation, which we call the GUMMA, G-U-M-M-A. Treatment is basically, for this organism, you basically antibiotics. If you remember, in the old days, we used to just say take a couple of penicillin doses and that's the end of it for the gonorrhea and chlamydia, but that doesn't work now. It has to be, we do give injections, intramuscular injections for gonorrhea. For chlamydia, we still take pills, either doxycycline or azithromycin. And for syphilis, it's still penicillin injections, at least 1 to 3 doses intramuscularly, deep intramuscular injections. Other common bacterial pathogens or organisms that cause infection, you've heard of Staph aureus, which causes a lot of skin infections as the one of the most common, abscesses. However, it can also affect, cause pneumonia and cause heart valve infections and other systemic problems, bone infections, muscle infections. Streptococcus pneumoniae is another organism most commonly known to cause pneumonia. However, with strep pneumonia, there is vaccination for this, which we recommend for those immune compromised to get. E. coli I put down here because it's also one of the most common, causes urinary tract infection, and also you've heard of food getting contaminated with E. coli, um, which is a different strain. It's the 0157 strain that causes severe infections and sometimes death. And that's where you see some recall from farms or in the supermarket where they remove certain vegetables off the shelves. Another common infection, especially in third world countries, is tuberculosis. And usually this is the great, what we call the great pretender, because it can mimic all the other infections, not just a lung infection, but can cause meningitis all the way down to bone infections, if you want to call it that. Next slide. The other two groups that I wanted to talk about was protozoal infections. Again, one of the more common protozoal infections is like trichomonas, another sexually transmitted infection, which is sexually transmitted, and other more worldwide known infections such as Entamoeba histolytica, which causes diarrhea, is endemic in the Philippines also. That's why we tend to boil our vegetables or cook our vegetables, because this is usually a fecally and orally transmitted organism. Plasmodium is the single cell protozoan that causes malaria, and obviously it's a worldwide problem, which the WHO has been trying to eradicate or control for years. Schistosoma is also common. We see it in parts of the Philippines. However, other parts of the country also have the same issue. It's more common. Its life cycle is with those seen in rice paddies, where people planting rice are exposed to the water, and these organisms penetrate their skin as part of their life cycle. For fungal infections, obviously, we have, as the picture suggests, um, um, athlete's foot, if you want to call it commonly, or otherwise known as tinea pedis, which are caused by multiple other fungi, not just by Candida. And Aspergillus is more common in individuals who have immune deficiency, such as chemotherapy patients or patients who have some blood disorder. Next slide. Viral infections. As I mentioned earlier, HIV has first been described in the early 1980s as an infection, an epidemic initially, which they thought was in gay men, and it was initially called GRID, gay-related infectious disease. And at that time, it did not gain any support or recognition as a major pandemic, because who cared about the gay population if they got infected, and good, there'll soon be none of them. Is what they had, as what the attitude of the time was. However, when heterosexual individuals started getting sick, there was more research done, and actually it was the gay community that brought this to the forefront and expedited multiple drug um, drug studies to try to help stem the epidemic at that time. HIV, as a general whole, is an immune disease. Um, is an infection that affects our immune function. It does affect what we call our CD4 helper cells, or T helper cells. And what it does is it multiplies in those cells and destroys them over time. So basically, the infection itself will not kill you, but it is the in other opportunistic infections related to HIV that will kill. So one of the things that we monitor in patients with HIV is the amount of CD4 in their peripheral blood at a particular time when you draw their blood. The danger zone happens when they usually drop below 200 CD4s per ml. At that time, the immune function is compromised. Individuals with CD4s less than 200 are at a higher risk for opportunistic infections like pneumocystis pneumonia, tuberculosis, cryptococcal meningitis, and many other infectious diseases. Those are the things that kill the patient. It's not the HIV infection itself. There are more than 30 different medications at this present time, which we tend to pick a combination of to control the HIV infection in certain patients. If you notice, 20 years ago, patients used to take a handful of medications, which was about 30 pills a day, sometimes to just keep them alive. Now, it's down to a single tablet regimen that can keep patients going, keeping them alive. And there's even newer medication now that you just can get a couple of injections monthly and hopefully bi-monthly, where you can control the HIV infection that way and not worry about taking your medication. Hepatitis A has been around for some time, B and C as well. Hepatitis A is not a chronic illness, so most of the time it's transmitted through fecal and oral, to the fecal and oral route, which means that contaminated food is what gets patients sick. B and C are transmitted differently. They can be transmitted sexually, and they can be transmitted to blood exposure, or it can be transmitted. B can be transmitted to maternal, from the mother to the child, and basically, hepatitis B 95% of hepatitis B is not chronic. However, there's a small percentage of that, the 5%, that can have chronic active hepatitis. And that's the one where it can be dangerous, where they develop cirrhosis or can get liver cancer and not do well. Hepatitis C is a chronic illness that has been more common lately, and there is medication to try to eradicate the infection. And lastly, for viral infections, we have SARS, COVID-2, which we are all aware that we are in the middle of a pandemic at this present time, and uh, we have which started, as you know, in Wuhan, China, and spread across the globe. In the United States, the first reported cases were in January of 2020 in Washington state, and it spread throughout the country. By March, we were in a complete shutdown at that particular time. There are, up to this present time, more than 1,000 deaths a day, more than 100,000 infections daily reported in the United States. Certain areas which are less vaccinated than others have a higher infectious rate than those in states that have a higher vaccination rate. Basically, treatment is all mostly supportive. There's only one approved medication, which is remdesivir, given to moderate to severe patients who are hypoxemic in the hospital in combination with steroid, or dexamethasone is the most common. Sometimes you may be able to add a monoclonal a drug such as tocilizumab or baricitinib, depending on availability. Uh, Other than that, it's mostly oxygenation with BiPAP, high flow nasal cannula, ECMO, or ventilation, or mechanical ventilation. Uh, uh, Vaccination, basically, you have uh, three in the United States that are approved, which is the Moderna vaccine, the Pfizer BioNTech, and the Janssen. And recommendations are for the Moderna and the Pfizer to get 2 shots, about 21 to 28 days apart. The Janssen vaccine is a single dose vaccine. Um, it has been recently recommended that booster doses be given for both the Moderna and the Pfizer at 6 to 8 weeks. The government is thinking of, I'm sorry, 6 to 8 months. The government is thinking of lowering that to 5 months after the patients have gotten their last second dose. Both the Moderna and the Pfizer vaccine are mRNA vaccines, which is new technology in the development of vaccine production, and that's the reason why we were able to come up with the vaccine very rapidly, as opposed to the traditional methods of making vaccine, which takes a little bit longer. Any other? Next slide, please. These are other vaccines that have been more common and dangerous: Marburg virus, the Ebola virus, hantavirus, which are all like hemorrhagic fever, and as well as dengue, which is common in the Philippines also, which can be life-threatening at times. The bird flu, again, which has been significant and has killed a lot of people over the years. Some of them are vector-borne, such as dengue, which is through the mosquito. Next slide. These are just some of the other bacteria. They're not clinically significant in the sense that they don't cause infections, but can be helpful in making bread, helping with digestion, helping produce food for in photosynthesis, for producing antibiotics like the penicillium fungus, just to give you a variety or a range of what these organisms are really capable of. Next slide. As I mentioned earlier, they help digest food, fix nitrogen in the atmosphere, help recycle nutrients to decomposition. It's like what fungi do in the floor of the forest, and give plants and roots, plant roots the access to nutrients. So hopefully, with the bacteria, it will help strengthen our body system. It offers you, like the bacteria on our skin, offers a layer of protection against pathogenic organisms. If in case we have any wounds, and prevents other more dangerous organisms from getting a foothold in our body. Try to avoid taking risks, wash hands, food handling, be safe, and take the initiative to try to get to know your environment better. So that's basically just a brief overview of what I do. And basically, I hope that you have any questions, which the aim was to just to get your mind stimulated to see if you had any questions regarding microorganisms. Thank you.
All right. Thank you. Thank you, Ronnie.